We can be the generation that ends the opioid epidemic. We can do it. That is why, effective today, my administration is officially declaring the opioid crisis a national public health emergency under federal law, and why I am directing all executive agencies to use every appropriate emergency authority to fight the opioid crisis. This marks a critical step in confronting the extraordinary challenge that we face.
President Trump last month declared the opioid crisis a public health emergency. The number of overdose deaths doubled over the 10-year period ending in 2015. More than 33,000 people died that year. There are more than 14,000 facilities around the country treating substance abuse. A group of public health experts wants to change the way addiction is treated in the U.S. Gary Mendell and Tom McLellan are leading the task force pushing for this change. On Wednesday, they released a set of recommendations for treating substance abuse called the National Principles of Care for Substance Use Disorder Treatment. Gary founded a nonprofit called Shatterproof after losing his son to addiction in 2011. He's here in New York. Tom served as deputy drug czar under President Obama and is founder and chairman of the Treatment Research Institute. He is with us from Sarasota, Florida. Welcome to you both. Tom, let's start with you. What central flaw in addiction treatment do you want to address?
Well, it starts with the concept. When you imagine addiction is something that happens to a very few people that have basically underlying character flaws or personality disorders, then the kind of treatment you provide is not medical. It's not covered by the same kind of insurance that the rest of medicine is covered, and you treat it very differently. Well, what the science now shows, without question, is it is a brain disease. The use of alcohol and other drugs at high doses regularly produces changes in the brain that give you the characteristic problems of addiction, the compulsion, the inability to stop, the loss of respect for things that you used to hold dear. When you see it as a chronic illness, then you understand that you need the same kind of treatment, the same kind of individualized care that other chronic illnesses have. With that, you can get success. Without it, you're just asking for repeated relapses.
Gary, you lost your son in 2011, and on your website, Shatterproof, you wrote a very moving tribute to him in which you also laid out a quote that was from a conversation that you'd had with Brian, and it reads, "Someday people will realize that I am not a bad person, that I have a disease, and I am trying my hardest." That was your son, Brian. What do you want people to know about him and the addiction?
Well, really what Tom just said. I mean, Brian did nothing different than anybody else his age, and statistics show that 10 kids will go in the woods when they're 10 years old and try beer for the first time or pot. 9, it'll be fine, and 1 will become addicted, the way it just connects with their brain. But once it connects, as Tom said, regions of your brain change, and it makes that person, makes it really difficult for that person to control urges. It makes them incapable of really, in some cases, making a decision and following through with it, like the decision not to take a drug. And incapable, just like someone who has diabetes, their body incapable of producing enough insulin. And those like Brian and 25 million people in this country are looked at like the bad person, the bad kid. And that, obviously makes it that much worse, so much worse.
Tom, let me ask you, some people might be surprised that these 8 principles are not being followed around the country already. How do you explain why they're not?
It's actually easy to explain, and it begins with how we've always thought about addiction. Addiction was always thought as a personality disorder, a character disorder. When in the mid-70s, and this is going to be familiar to a lot of people, in the mid-70s, when returning war veterans came back with opioid addiction problems, it was simply impossible to incarcerate or stigmatize that group of people. So they created a purposely separate system of then 15,000 addiction treatment programs, purposely separated from the rest of medicine, financially, geographically, and culturally. It was never part of healthcare because it was never thought to be part of healthcare. I don't fault anybody for that. The science wasn't there. Well, now it is. And it's important to say that the principles that we're talking about are not Gary's and not Tom's principles. These derive from the Surgeon General's report on facing addiction in 2016, reviewed by hundreds of experts, agreed to by all 5 federal agencies that are responsible. And they call for recognition of the new science, that this is a brain disease that manifests in terrible behavioral problems. But it is preventable. You can intervene early before the brain changes occur. Well, it's cheap to treat. But once it occurs, you need enduring, continuing, individualized care and monitoring. With that, recovery is an expectable result of good care.
Gary, we played a clip from the president's declaration of a public health emergency.
Right.
What's your assessment of the Trump administration's treatment of this issue and handling of this issue so far?
So far, they've done very little. And the declaration 2 weeks ago was certainly a step in the right direction. Very positive, brought attention to it. But there was really no tactical business plan. Okay, here's the 10 things we're going to do. Here's the date we're going to get them done by. There was nothing except for the IMD exclusion, which is a small thing. A good thing, but small relative to the big pie. It lacked substance. And it doesn't mean there won't be substance. I can't predict the future. But up till now, there hasn't been anything, or very little.
Well, Tom, the president also talked in his speech about the flow of illicit drugs into the U.S. Do you think that there's too much focus on the supply side when the White House talks about the opioid crisis?
Yes, I do. This has always been considered the kind of problem that happens to some people in the United States because of the actions of foreign nations or rogue states. Let's think about alcohol, tobacco, and now prescription opioids. What do they have in common? They're made in the USA. They're all part of our culture. Some of them, alcohol and tobacco, are among the most politically protected and supported addictions that we have. And they have the kind of devastation that is now more popularized with the opioids. But no, it starts with understanding at the public health level that the use of these substances at a level that is dangerous to the individual or to those around them is the beginning of addiction. It's not addiction yet, but that's where it starts, and that's what could be changed.
And Elaine, if I could add to that, what the public doesn't understand is 80% of those people who are abusing heroin and potentially fentanyl and carfentanil started with legal prescription pills prescribed here in the United States. 80% started with legal prescription pills.
Wow, that's an important point.
We still prescribe in this country 4 times the amount of opioids, legal opioids, per patient, excuse me, per 100,000 population than the UK. 4 times. We don't have any more pain than the people in the UK.
Well, Gary, let me ask you, you shared some recommendations earlier this year with New Jersey Governor Chris Christie, who's heading up the President's Commission on tackling the opioid crisis. What was the response to that?
Very good. The governor was very receptive. I spoke with each of the members individually on different occasions and met with them individually on separate occasions. And the recommendations that came out I thought were very complete. Sure, there were some I thought should be a little stronger, but on the whole, I thought the recommendations were superb. And now it's a question of the commission is done. They've done their work. There's 56 recommendations. Now it's up to the administration to act on them.
All right. It's such a critical issue. I thank you both, Gary Mendell and Tom McLellan, for taking the time to talk to us about it. Thank you.
Great. Thank you.
Happy to do it.